The last 24 hours, the country has recorded 53 new cholera cases, with most cases recorded in remote areas. This fresh outbreak is different from previous situations where the disease mostly affected urban settlements. ZTN Prime's Mira Insingo gives us more in the following report.
Some religious actors are reportedly spreading the outbreak due to lack of basic hygiene. Stakeholders have called on government to rigorously engage apostolic sects in its fight to contain the current cholera outbreak.
We have not done enough to engage the leadership of the apostolic sects. It is important that the government reaches out, to the leadership of those so-called religious objectors. We know there are still challenges, especially in terms of health-seeking behavior. There are still challenges in terms of some of the, religious, beliefs that they continue to follow. We know when they have those huge gatherings, there's generally poor sanitation services. Some of them continue to greet each other, handshaking and so forth. Some of them continue to wash their, the dead bodies of their colleagues who have died.
To contain the outbreak, the government has moved in to monitor all funeral gatherings in affected areas. Cholera cases have been reported in all the country's 10 provinces, with Manicaland, Masvingo and Mashonaland East recording alarming spikes.
Cabinet further reiterated additional measures as follows: that all gatherings in cholera-affected areas be supervised in order to ensure adequate clean water and sanitation provision, that all burials be supervised regardless of the cause of death in all cholera-affected areas in order to reduce transmission, that all public health measures be enforced in all communities reporting cholera cases.
Since the first outbreak in February this year, at least 5,000 people have been infected and 116 have succumbed to the primitive disease. Adequate clean water and sanitation are critical in curbing the recurring cholera challenges.
Invested, in water and sanitation infrastructure, even after the cholera outbreak of 2008-2009, which I think was a marker for us to invest in water and sanitation infrastructure. A majority of people in the rural areas, they used to rely on boreholes, and most of those boreholes were sunk in the early 80s. Unfortunately, majority of them have broken down. Hence, they are now relying on unsafe, alternative sources of water, especially along the riverbeds.
Will the interventions contain the ravaging outbreak? Only time will tell. For ZTN Prime, I am Mira Insingo.